Okay. So the topic very clear cut, science behind patient's dental visit. So we are going to look at the science, okay, of why patients come to a dental clinic. All right. So let's start off with a quiz and let's see if you can answer this quiz. Maybe we can have a chat response to the questions that I'm going to ask you. So let's begin. Can you take a guess the clinical condition that is shown here? Take a guess and put it in the chat box. What do you think? And maybe the moderator can let me know first few answers. What do you think this is? Type in the chat box the clinical condition. Yeah. Okay. Let's have a. Okay. Let me see that I can access the chat as well. All right. Periodontitis, generalized periodontitis, absolutely correct. Generalized chronic periodontitis, superb, wonderful, excellent. Let's have a look at another picture. What is this? What do you think this is? All right, go ahead, type it in the chat. I can see your chat now. Very good, excellent. Grossly carious, deep carious lesions, caries, grossly carious, absolutely wonderful, fantastic. Let's have a look at one more. Whoa, what do you think of this? Pretty gross, right? What do you think this is? What is the first thing that comes to your mind? I know you cannot do your full diagnosis, but what do you think this is? What do you think this person is suffering from? Beautiful, absolutely correct. Carcinoma, cancerous growth, cancerous lesion, wonderful. All right, and we'll do one more. All right, let's see if you get this right. What do you think this is? A 5-year-old child. What is this clinical condition called as? 5-year-old child. What do you think this is? Absolutely correct. ECC, early childhood caries. Absolutely fantastic. Very good. So, I mean, ma'am, I think the interns are quite good to at least identify with a certain precision. I think I must congratulate the interns. Quite knowledgeable. That's very good. That's very good. Okay. So now tell me something. Among all these 4 pictures that we have diagnosed, could we have prevented this from happening? Just type yes or no. Could we prevent this from happening in the first place? Yes, no. All right, absolutely correct. This all could have been prevented because all these are preventable conditions, right? Now, tell me the pattern. What is the pattern between the patient's visit, right? Had the patient come early, we could have prevented it, right? Now the patient has come in such an advanced stage. Now that we have to do some surgical intervention to get the oral condition back to normal. Is that right? So you see here the pattern is that the patient has delayed his treatment to such an extent that we now need to do a lot of surgical intervention in this. All right. Prevention would have been so much simpler for us, so much simpler for the patient. But I don't know, for some reason, the patients have not sought dental treatment and it has come down to this. And when you tell the patient this tooth has to go for a root canal and he's like very upset. So why root canal? Why we cannot do cement, cannot use cement, cannot restore? Why do we have to go for restoration? Or you ask the gentleman with the cancerous lesion, you have to go for a resection of the jaw and the lymph node and the block resection of the neck, and they are so upset that so much surgical intervention, and people are quite upset, but they don't understand that they have delayed the treatment seeking, right? They have put everything on hold for some reason or not. And in today's session, we are going to try to understand. Of course, we cannot have a full understanding, but we're going to try to understand the patient's treatment seeking behavior. What makes patient come to the dental clinic? What makes the patient repeatedly attend the recall visit? What makes the patient repeatedly attend the review appointment? So what is that is going on in the patient's head? So this session, I think we're gonna look into that and try to understand the science of why this happens. So once you leave college, interns, and when you enter the real world, okay, you must understand that dentistry is a service-driven profession, right? So when I say service-driven profession, it is more like a client-customer relationship that you will have with your patients. So you will be looking at clients, the patients will be coming to you, they're going to discuss your problems and they will ask for your services that you can provide. Then you're going to convince them the services that you can provide, and then the patient will agree to your services, and then he will have your services. And if your services are good, the patients will keep coming back to you for repeated services. Otherwise, the patient is not going to come back to you. So bear in mind that we are talking about profession which is service driven. So if your service is poor, definitely you will not have any customers, you will not have any clients, you will not have any patients. So we are talking here about client acquisition to client retention. So both of these are very important when you enter the real world clinical practice. So what are the factors which influences the patient's decision to visit a dentist? Okay, what is going on in the patient's head? What are they thinking, right? So we are going to dip into the patient's psychology, okay, on when they want to visit a dentist. So broadly, we can divide it into what is going on in the patient's head before the visit, during the visit, and after the visit. Okay, so this presentation will have these three sections. So let's jump into what is happening with the patient's thought process before the visit. So you see here, I've given you a chart and I have hidden one part of the chart which I will reveal to you later. But so much literature is there on the patient's health-seeking behavior, right? And from all that literature, this particular model, psychological model of patient's dental visit was developed, and it pretty much summarizes why the patient decides to come. So first and foremost is, you can see here in the top is your dental anxiety, okay? This is the reason number one the patients do not attend dental practice, right? So they are scared of needles, they have a personality which has got very high anxiety, and they are very scared of the unknown that is going to happen in the dental visit. So this is the patient anxiety. So most of the time the patient anxiety keeps the patient from attending the clinic, okay? The next one is your perceived need, okay? This is a pretty much important here. The perceived need for treatment based on symptoms of pain or beliefs about susceptibility. Now the patient has pain, right? So he does not perceive need for treatment if he takes a painkiller and the pain subsides, correct? And that is what is happening currently. So the patient has a toothache, he goes to the pharmacy, he buys one combiflam, he takes the combiflam, the patient goes away, the patient does not perceive the need for treatment, okay? So when would you think the need for treatment will come? When the pain is not relieved by the painkiller from the pharmacy, and then the patient will come to you because now the treatment needs have arisen. The patient now perceives that I need to go to the dentist. So this is very important because different people have a different thought process, right? And different pain perceptions. So some patients may get relieved by combiflam, and they will eat combiflam for 3 months, 6 months, all right, till the tooth breaks off and the pain is relieved completely and the tooth has got root pieces remaining. And there are some patients who will have combiflam for 3 days and then they will come to you. So this is very important to understand. The patients perceive things differently, all right? The third one is cost, right? So here I would like to say, so many times you must have also heard is dental treatment is not costly, dental neglect is costly. So if you neglect your condition, ultimately so much surgical intervention will be required and you need to pay for all that, right? So the most of the time the patient have this concern for the cost. How much will it cost? Will it cost too much? Will I be able to afford it, right? So all these things are running into the patient's head before they decide to come to the clinic. The fourth one is feeling towards dentist, all right? Feeling towards dentist, right? And this is here where if the patient already knows you from somewhere, right, he will feel comfortable to come to you. But if you are totally a new person, he may not feel. A typical example is in your community, if you are doing a lot of community service, like going for school dental programs, organizing school dental programs, participating actively in your dental association programs, participating actively in your community programs, right? So the people will get to know you before they visit you, right? So they know that, okay, there is a dentist, Dr. Fawaz. I have seen him so many times attending the meetings, and he's very nice. He's so very soft spoken. So this people will start have this feeling of familiarity with the dentist, right? So if the patient has this feeling, he will not hesitate to attend. But if he doesn't, then he will not attend. So this is also going on. This is the reason why we all must take active participation in community service, in dental association programs, in community services and otherwise. So here also the patient really looks at dentists who they are familiar with. The last one is pressure from work, family and neighborhood. Okay, so now the patient who is suffering from a toothache, he's attending his office and he's not able to work properly. He's not being productive in the office. Okay, maybe a factory worker, his pain is affecting his work. The boss recognizes that this person is having a problem. He approaches, what is your problem? Why are you not working properly? Why are you taking so many leaves? Right? So the worker says, I've got a toothache, and the boss says, you take leave today, go to the dentist, have that tooth extracted, and then only come back. So this is kind of a pressure from the workplace, right? Even from the family also. Maybe if you have a toothache, your mom will keep telling you, go see a dentist, go see a dentist, go see a dentist. So if this pressure is there from the family, from the workplace, right, the patient may decide to attend the clinic. So these are some of the very established factors which influences the patient's decision to come to your clinic in the first place. So let's see what happens at the visit. All right. So when I say at the visit, I've put a big picture of a mouth, right? And this is the quote I always quote my students is, look before you leap, think before you speak, because you are on camera, right? So the moment you open your mouth in front of the patient, right, you must be very clear what are you talking about, right? The patient is going to perceive and have some thoughts regarding you. And in this today's era, the patients may also be recording you on their mobile phone, all right? And they will also be recording your behavior in their camera. So you are continuously being evaluated by the patient. The time you come in front of the patient starts judging you. He starts evaluating you. He starts assessing you. Is the doctor good? Is the doctor rude? Is the doctor nice? Is he telling me properly? Is he raising his voice too much? Is he comfortable with me? All this evaluation is going on into the patient's head. Okay. So now let's see what happens in the visit per se. So when the patient is evaluating you, right, he's sitting there and you're doing all the talking, he's evaluating you for three main factors, right? Number one is information. What kind of information are you giving? How much information are you giving, right? And number three, is the information relevant to the patient's preference or the patient's need? Very, very important. Most of the time, we keep talking from our perspective. We keep giving information from our perspective, and we never realize that the patient has got his own perspective. He's got his own preferences, right? A typical example is the patient has come. Remember the patient I talked to you about, a factory worker. The boss sends him to get that tooth extracted because the company is suffering because he is not productive. Imagine that person comes to you, okay? He is going to request you, doctor, I've got this toothache, you please extract it. What are you going to do? You're going to take an X-ray. On the X-ray, you will see this tooth can be saved. All right. And from that moment, when you see the tooth can be saved, you start informing the patient about root canal. Get the root canal done. We can save the tooth, or everything will be normal. You don't need to extract. But we never realize the worker's plight, right? He wants his tooth extracted, maybe because he doesn't have so many medical leaves. Maybe he doesn't have any leaves, right? Maybe today is the only leave that he's got. So from our perspective, we keep bombarding the information about root canal when actually his preference is a simple extraction so that he can go back to work, right? So this is kind of the information I'm talking about. Then the communication, right? The communication is a different ballgame. How you speak, your tone, your pace, right? The words that you use, the facial expression that you use, the non-verbal communication that you use, the motion of your hand, they all are transmitting a personality information about you to the patient, and the patient is perceiving all that. The patient is absorbing all that, right? And this including is your technical competence, right? So technical competence, a typical example is you take an X-ray, the X-ray has not come back nice, okay, a big cone cut, you go take another X-ray, the cone cut is smaller now, but the X-ray is badly developed, you again go back, take a third X-ray. So this is the technical competence the patient will be evaluating you from, okay? So this is about X-ray. Another is you examine the patients completely, and the patient asks you, is there anything else in my mouth? And you're like, oh, I just saw the tooth that was painful. I did not check the other tooth. Oh, please sit again. I will check again. Oh, this is a poor technical competence, right? So just keep in mind all these three factors: information, communication, and technical competence is going to decide what kind of care are you going to provide for the patient. From these three, the patients will evaluate you on the quality of care that you are able to provide. Are we clear on this? So this is very, very important. So once the patient has a good impression about you, right? He prefers that you give him the correct information, and very, very important is you give the patient emotional support. The patient prefers a dentist or a doctor who gives emotional support, who is empathetic, right? So when I say emotional support, right? Empathy is that you must keep yourself in the shoe of the patient and look at the circumstances. So that is empathy. If you do that, the patient is very, very happy with you, and the patient is expecting this from you. A very typical example about emotional support is that so many times it has happened that I have a stomachache, okay, and I cannot relieve it by Eno, I cannot relieve by Gelusil, so I decide to go to the doctor. I'm having this stomachache. The moment I step into the doctor's office, my stomachache is gone. And the doctor is asking me, okay, tell me, where is it hurting? And I'm like, I don't know, it was here. But as soon as I arrived at your place, it's just gone, right? This is kind of emotional support that the doctor has given you, that your symptoms have disappeared. It's very, very common. You will have this, the patient is complaining of pain here, and then suddenly he sees you, he sees your pleasant face, he sees your pleasant smile, he sees a very comfortable environment, and you suddenly forget about your pain, and you're like, pain was here, or pain was here, or maybe it was here. I just totally forgot where the pain was. This is the emotional support I'm talking about. We have been doing this unconsciously, okay? But the science tells us that this is a very, very important aspect of delivering patient care. So now let's see how this information and emotional support can be given to the patient in a clinical scenario. All right, so now let's have a look at this model of care, right? Again, science has given us the model. The science has provided us with all the information that we need. It is just that we are not reading enough, all right? So I pulled out this model from a book, and this model tells us about the information and the emotional support that you can provide to the patient, right? So you have to provide the information information and your emotional support at entry, during surgery, and also at the exit. Okay, now you're going to ask me, what emotional support am I going to provide? Okay, so let's take an example of the emotional support you can provide at the exit. So when the patient is about to exit, check the patient's feeling about the visit prior to the patient leaving the surgery. Have the courtesy to ask the patient, how is the surgery? Are you all right? Are you okay? Are you able to go by yourself, or should I arrange somebody to escort you to your parking? Right? Are you comfortable? Is there anything I can do for you? Okay, these words are your emotional support. Okay, so you have to say these words, and the patient will suddenly, his pain threshold will drop. Even the thing which was making him uncomfortable, because of your emotional support, the thing will disappear. The patient will feel very comfortable. No, I'm fine, doctor. It's absolutely fine. I was having some discomfort after the extraction, but I don't know, suddenly it's disappeared. I think it's fine. And the patient himself is surprised. So this is the emotional support that we have to provide to the patient. And if you see in the last box, thank the patient for making the visit. Thank you so much for coming in. I hope we have given you good services, right? Let us know if you need anything else, okay? Please do not hesitate to call the reception anytime. We have an emergency line, even in the middle of the night. If you find something, it's okay, you can call us. So the patient now feels very, very comfortable. Because your emotional support, he feels connected to you, right? He knows now you are approachable, right? So even if he's having pain in the middle of the night, he will not call you, right? Because he's now emotionally connected to you. He will think, oh my God, doctor must be sleeping, I should not disturb him. I'll wait till the morning, and 7 o'clock in the morning, he will call you, doctor, I'm having pain, right? And you're asking him, why did you not call me at night? And he's going to tell me, I did not want to disturb your sleep. Now, compare this with a patient who you have not offered any support, okay? What is the problem? Say, just imagine role playing. This thing, you want extraction? Okay, extraction, sit, LA, extraction, bite on this, don't eat, drink, blah, 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 blah. Payment, out. Okay, so no emotional support, no emotion. If that patient has pain at the night, he is going to call you in the middle of the night, right? That patient, when he leaves, he has no bonding with you. He will never come back to you. Only if it is die or do situation, he will come back to you. Otherwise, he is not emotionally connected to you. He will never come back. So don't expect patients to come back if you're not providing any emotional support. So when I say emotional support, even a simple statement like, how are you today? Finish. Enough for emotional contact. Okay, emotional connection. How are you? All is well? How is your, we say here, how is your Christmas? You can ask, how was your Diwali? Did you go out this Diwali? Did your parents visit you this Diwali? Right? And now you are connecting with the patient on the emotional level. So the patient who is connected with you on the emotional level will feel comfortable with you, and you will have less chances of somebody suing you for malpractice or negligence. Okay? Very important. Say a patient who's emotionally connected to you has dry socket after 3 days. He comes back and you realize there's a dry socket. Okay? He is not going to get furious with you. Did you break the tooth inside? Is there some tooth still remaining inside? Have you taken everything out? These questions they will not ask because they are emotionally connected to you. They are very comfortable with you. They trust you. So this is the model of the care we must apply in our daily practice. So interns, when you leave your safety net of the institution, right, try to implement this model in your practice anywhere you go. All right. So this is what I wanted to drive home the point. Information and emotional support is a must for patient care. So what happens after the visit, right? So after the visit, there are two things. Patient's expectation matches the patient's perception. What it means is that I'll give an example that the patient, say you go to buy a shirt, all right? So your expectation is that when you enter the shop, you will be greeted nicely. Then there will be a salesperson who will approach you. This salesperson will show you all the designs of the variety of the shirt that they have, right? And they will patiently wait for your decision, right? And if you don't buy the shirt, okay, he will smile and say thank you. You will smile, say thank you. Or if you buy a shirt, you exit. So when you exit, when you come out of the shop, you will be like, wow, what a nice shop. That salesman was so nice. He showed all the shirts that they were there, all the varieties of the design, and he was very patient when dealing with me, and the experience was very smooth. Maybe I want to come back again because the service is very good. The collection of shirts are very good. Take your extraction example. The patient expectation is extraction, all right? So patient has come with an expectation of that you will extract the tooth, but you are trying to bombard him with RCT, 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 RCT. Maybe you want to go to, Nepal for a vacation and you're falling short of $2,500, and this RCT is going to get you $2,500 for you to go to Nepal for vacation, and you're like RCT, 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 right? And the patient doesn't want an RCT because it's already 3 visits, so much cost. The patient exits your clinic. Now the perception he will have of the visit is that that dentist is so bossy, right? He was trying to push RCT down my throat. I don't want to go to this dentist any longer, right? And I'm going to tell people also not to go to this dentist is too bossy. They want to do what they want to do, not because what my preference is. Finish. The patient becomes very unsatisfied. So perception, the expectation does not match perception. Okay. So this is very important for patient satisfaction. It can happen with us also. So dentist expectation, right? The patient has come. The patient will pay for root canal treatment 2,500. What is the root canal molar treatment? What is the cost of molar in India? Can somebody type in the chat box? What is the cost of root canal treatment, permanent molar in Nasik? 3,000. Right. So your expectation is the patient will get root canal and I'm going to earn 3,000. The patient is 5,000. Yeah. 3,000 to 5,000. 300 to 5,000 or more. Oh, okay. So your expectation 3,000. Okay, 3,000. So 3,000 is your expectation, and you also expect the patient to pay the full amount upfront, right? That is our expectation from the patient, right? What if the patient says, "Okay, doctor, you do the root canal, you start treating, you do the access cavity opening, you use hypochlorite, you use all these machinery from foreign, try to impress the patient." At the end of the appointment, the patient says, "Doctor, I don't have the money right now. Can I pay you later? Can I pay you in the next visit?" Okay. Now tell me, what is your perception? Type in the chat box. What is your perception regarding this patient? The patient who agrees for root canal for 3,000, okay, and who doesn't want to pay, he doesn't have money in that appointment, and he's requesting you to pay in the next appointment. How are you going to feel? Type in the chat box. Let me see how you feel. Let me know how you feel. How would you think? What would you think? What will go on in your mind? Absolutely not good. You'll be disappointed. Very good. So this, that is correct. Ma'am says, "Itna sab karne ke baad." So your perception does not match your expectation, and then you are going to feel unsatisfied. So right, you understand the situation here. So the expectation has to match the perception, not only for the patient but also for the dentist. Because when I see the same patient in the next appointment, right, my feelings would be different. Now let's see what those feelings are. Okay, here I put in the patient's perception does not match the dentist's perception. Okay, now when the same patient comes back, the same root canal patient who is not paid, he comes back in the next appointment, he is expecting you that you will be all nice to him, very cordial, and use all the foreign gadgets to do the root canal. So his perception is that this is what is going to happen. So his expectation and his anticipated perception. Now you tell me, what is your perception? So when the same patient comes back, as he enters your clinic, the first thing that crosses your mind is he going to pay for this visit and the last visit? So this is going on in your head. Okay, and this question you will not ask him until you finish that appointment. So you see, your patient's perception and your perception, if they do not match, both of you will be unsatisfied. So as a patient, he would not like to come to you. As a dentist, you would not like to treat him again, right? And this is where the imbalance happens and you start losing patients. So this misperceptions can happen for a lot of reasons, right? One of the reasons that I have put, absolutely. Ma'am says you make your receptionist to confirm beforehand, before he enters the operatory, that the payment has been done. Absolutely. We have to take these strategic steps, right? Strategic points to ensure that this does not happen. So one more thing is that if the information that you provide is not according to the patient's needs or preferences, you will have this imbalance of perception and then unsatisfaction. Patient's needs is extraction to be done today, now. Or my preference, can you do it now? Okay, and now you don't want to do it now. Okay, maybe you have lunch with friends. Okay, maybe you have to go out somewhere, and you tell the patient, I have to give you an appointment. I cannot do it today. I have to give you an appointment, and then there is a problem. So this thing can happen in the clinic. So remember, expectation equal to perception is good. So nearing the end of my talk, this is the other half of the slide that I showed you in the beginning. So as a consequence, what happens? So many things can happen. If your treatment has reduced the symptom of pain for the patient, the patient has got pain relief after you did something, right? He's going to come back. Patients the patient perceives reduced need for treatment. So patient came for an extraction, but you did a simple restoration. The pain was relieved, and the patient thought the extraction, which will cost 300 rupees, okay, the doctor has only taken 200 rupees and he solved my problem, right? So this is gonna go as positive. Satisfied with the information supplied by the dentist. So you look at the patient, right? The patient is coming from a lower socioeconomic status, right? So the amount of information you give and the way you give should be according to his intellectual level, okay? So you don't tell him that I'm going to use a Siemens root canal apex locator for your RCT. It does not matter to him, okay? It only matters pain relief. So all these things, information that you give, the patient should feel satisfied. And then, sorry about that, the patient perceives you as a sensitive person who satisfies the emotional needs. This all thumbs up. Patient gets that feeling, emotional connection is wow, bale bale, okay? Then last is support from workplace and family. Support from workplace and family. So if you go back to your workplace and the boss says, say for example, it happens with students, that students are having their orthodontic treatment and they come to me and tell me, sir, I cannot attend the afternoon session of the clinic because I have an ortho appointment to change my wires. Okay, so I tell him, okay, it's okay, no problem. As soon as you finish your appointment, you join the class. Even if you are in the middle of the class or near the end of the class, you come into the class. So this is the support I am giving to the student to attend his dental appointments. So this support system also has to be there from workplace and from family. So this is going to make the patients come back. So if you see the arrow, they keep going round, round and round. So this is a cycle that we need to start to have. All right, very good. So having the knowledge of all this is basically going to build a very strong dentist-patient relationship, right? A very strong dentist-patient relationship, and the strength of this bond will decide the outcome of the treatment. All right. So even if you do a substandard treatment, right, the patient is gonna feel happy about it. Okay. Even if you screw up things, right, and you tell the patient, oh, this root canal file got broken in your canals, we have to do something about it. So the patient will say, it's okay, doctor, I trust you, right? I know how you are. I trust you. If it got broken, it's okay. You do whatever is required. So that is the strength of good patient, dentist-patient relationship. All right. So in this slide, I have summarized, again taken from an article. It basically summarizes the clinical implication of having good patient-dentist relationship. Okay. So just take a few. Reduce dental fear and anxiety. Okay. Reduced conflicts between patients and dentists. What basically means, you want to do root canal, he wants to have an extraction. All right. So we have to balance this out. Okay. We have to perceive what the patient's expectation is, right? And then we have to act accordingly. We have to take into account the patient's preferences, right? What does the patient want? We have to ask. Okay. So the patient walks in, you ask the patient, how would you like me to treat it for you? The patient will say, doctor, can you please extract it for me? And you ask him, why are you so interested in the extraction? He will tell you, because I don't have any leaves and I work in a factory and I have to change 3 buses to come here, right? So if you do the extraction, this tooth is not going to hurt me anymore. That is the point. You must take his preferences into the account, and you never should talk about root canal to him. You have to go for extraction. And when you talk about preventive measures, you have to talk about preventive measures, how all this could have been avoided. And in the future, there is an option of root canal treatment also. So basically, you need to balance the information you have to give out. This is a very gross or a very widened explanation I'm giving out to you, but you have to take patient's preference into the picture. Okay, maybe you want to give him an option of root canal also. Tell him, I can do the root canal for you, I can do it in one visit, okay, and this is going to be the cost. Okay, so if really coming to you is a problem for him, so he's gonna tell you his second preference, I cannot pay you for the root canal, I can only pay you for the extraction. Finish. Case over, case done. Don't try to pester him, bombard him with root canal. Okay, go for extraction, things like that. Okay, so then you yourself will have less professional stress, less defensive behavior. Okay, because you all comfortable with the patient is comfortable to you, you are happy to see the patient is happy to see you, right? So your day will go on well. So this is a summary of what happens with the scenario. Last question, okay, the end of my slides, is how are you going to implement all this knowledge, right? So you already know so many factors before treatment, during treatment, after treatment, but when it comes to implementation, it is a different ball game. So if you see in the picture, you need to have supporting skills of which we call it as soft skill. Now, your soft skill consists of communication, verbal, non-verbal, accountability, critical thinking. Are you able to analyze the problem the patient is giving you? I cannot come, my factory work is there, boss not allow. You have to critically think a solution out of it. Then time management, not for yourself, but the patient also. Make sure the least time is required. Patient is not kept waiting in the waiting hall, things like that. And the last is professionalism. Professionalism is doing the right thing for the benefit of the patient. Okay, don't take the patient for a ride. So this professionalism is also there. Punctuality comes in professionalism. Competency comes in professionalism. So this soft skill is a totally a different ball game, and this totally needs another hour or so to talk about. But this is what you need to do in the next steps. Okay, so I have given you the science. Now, next step for you would be try to explore the subject of soft skills and try to get some webinars on that. Try to understand that, and that is going to help you in implementation of the knowledge in your day-to-day life. All right. So I hope the webinar is informative, and you're able to take home some good information here. And I would like to take this opportunity to actually commend the initiative by the NAC committee and the internal quality assurance cell of MGV Dental College. That's a very nice initiative to start this particular scheme of capability enhancement and development scheme for students. I think this scheme should provide you with a good platform, good foundation for transition into your real life as dental practitioners outside. And it's really nice of you to invite me here, and it's my privilege to talk to you. So thank you from me.